Hello there, my name is Amanda. I'm one of the Sales and Education Specialists for LTR Medical. Today I would like to show you a demonstration of the Accufuser. The Accufuser is an elastomeric device and it comes in a multitude of applications and ways in which it can be used. We have continuous mils per hour. We have selectable continuous, which is what I'll be demonstrating today. And we also have an option to have a PCA functionality. It also comes in a multitude of sizes from 60 mils right through to 600 mils. Today I will be demonstrating on the 300 and the 600 mil device. So that you can see, this is the size of a 300 mil device. I've used food colouring so that's easy viewing. And this is the size of a 600 mil device. Interesting things to note about the Accufuser is, upon filling the device, you do not need to fill to 100%. You do need to fill to 50%. So for example, if we are using the 300 mil device, you must put in 150 mils, but you can put any amount from 150 mils until 300 mils. That goes with all of the sizes of the Accufuser. When you're getting your Accufuser off the shelf, just be mindful, it is just the device itself in the sterile packaging. You will also need to grab yourself a carry bag and the catheter of choice which your surgeon or anaesthetist will be using. Now if we look further along the device, we can see that there's a white plastic casing down here, so that's a fabulous place to put your drug label. We then have the filling port. This filling port has a one-way valve, so you can inject fluids into the elastomeric device, but you cannot withdraw from the device. If we continue further down the line, you'll notice that there is a line clamp. Upon filling the device, I recommend you do not need to clamp the line, and I'll explain that a little bit later on. As we are demonstrating the selectable continuous, you can see that this is how we select our rate. We line the desired rate up with the arrow and then we remove the key, so that can't be changed by patients. Continuing further on down the line, we can see we have an air elimination filter and an antibacterial filter. This is very important. During the filling of the device, you'll notice that there is an arrow on the filter. This needs to be pointing upwards towards the ceiling so that we allow the air to escape first. Trapped air bubbles within the filter may make it run not as effectively as it should, so the rate may not be as accurate. So therefore, always make sure you are pointing the arrow towards the ceiling upon filling of the device. Last but not least, you'll see that there is a blue cap on the line. This allows air to exit the line, but it does not allow fluid to escape. So you can keep this blue end cap on right up until the point of connecting to your patient. I will now show you how to fill the device. We aseptically open the filling port and you'll be able to see that minimal pressure is required. This will fit in any Luolock syringe, and upon depressing just with my thumb, it is easy to fill the device and you can see the balloon inside expanding. This will obviously expand all the way until it's full, and upon it being full, the balloon will fill the device completely. I'm not going to completely fill the device for the purpose of this video, but I will pop another one in just to show you how easy that is. Now the reason I mentioned earlier is why we don't keep the line clamped. That is because upon filling of the device, fluid goes up into the balloon, but it also extends down the line as well. And we will have our filter pointing upwards to the ceiling. So we now know that upon removing this cap, we will see our first drop of fluid. That's coming nicely now, and that can now be connected to any Luolock catheter. This is obviously for post-operative pain relief in this instance. We've just seen our first fluid drop there, so that line is primed. So that will fit any Luolock catheter. The Accufusers are NR fit, ready to go. When your hospital has neuraxial connections, we can supply to suit your needs. As I described earlier, this is the keypad. So at the moment, we have this one set at 15 mils an hour. You can see the arrow is pointing directly to the 15. If your surgeon or anaesthetist instructed you to set that at 5 mils an hour, you would just rotate clockwise or anti-clockwise, point it towards the 5, and once again you can remove the hexagonal key. It is ideal to keep these keys on the locked keys so that each ward area has the option to be able to change the device if need be. Now at a ward level, what's important upon receiving your patient is to confirm that the sticker that's situated on the device, which would have come from the prescription of the doctor, is accurate. Make sure you check your drug chart and make sure that matches up. Please don't ever have the filter taped to the skin. That is purely an air elimination filter, so make sure that that is not taped to the skin. Some other elastomeric devices require a flow controller to be taped to the skin. That is not the instance with the Accufuser. And last but not least, it may be difficult to see on camera, but you can see that there is an internal gauge on the inside of the device. So when you are doing ward observations, make sure you record how much fluid is remaining, and as per hospital protocol, do your observations at the appropriate intervals and record the volume to be infused, along with the rate. Make sure that you've checked that the rate is set correctly. My contact details are 0431 879 422. Should you have any further questions, please don't hesitate to give me a call. Thank you and have a great day.